Okay, so this is our presentation on cancer and nanotechnology. So today we will be covering the main aspects of cancer and how it develops, as well as nanotechnology and how it's used in the medical field. We will also discuss how nanotech has been further implemented to help cancer patients. And lastly, we will go over current statistics on nanotech benefits and future developments within cancer and nanotechnology. All right, so what is cancer and how does it develop? Cancer is characterized by the uncontrolled division of abnormal cells in a certain part of the body. Cells usually undergo a regulated process of growth, division, and death. However, cancer cells evade these controls and start to rapidly multiply. The development of these cells is usually due to a series of genetic mutations or alterations that have accumulated over time, that then begin to disrupt normal cellular processes. These mutations can take place due to several external factors like tobacco, UV radiation, and some chemicals, but mutations can also be caused by genetic dispositions. There are three main genes that regulate the prevention of cancer: DNA, of course, tumor suppressor genes, and oncogenes. These three genes are vital in regulating cell growth. Therefore, if they undergo mutations, it can lead to the development of tumors. Cancer begins to progress after cells begin to divide uncontrollably due to the mutated preventive genes. And since these cells are now growing rapidly, they often don't develop into mature cells with specific jobs. Slowly, as the tumor grows larger, cancer cells signal the tumor to create blood vessels to further develop. All right, so to look at the bigger picture, there are three main stages of cancer. First is the initiation, when cells first undergo mutations caused by external factors or genetic dispositions. The next stage is promotion, where the cancerous cells grow uncontrolled, and lastly is progression, an advanced stage of cancer in which cancer cells start to invade nearby tissue in order to establish a secondary tumor. Aside from that, of course, there are the more commonly known stages of cancer. Stage 1 cancer is diagnosed when the cancer is still localized and hasn't spread to important tissues. Stage 2 is identified when the cancer has grown but still hasn't spread much. Stage 3 cancer is diagnosed when the cancer has grown larger and began spreading to lymph nodes and important tissues. And lastly, stage 4 cancer is identified when the cancer has spread to organs or other areas of your body. Okay, so while there isn't a way to completely heal cancer, doctors use chemotherapy to treat cancer. Chemotherapy is designed to target rapidly dividing cells in one's body and kill them using chemo drugs. These drugs are delivered to the body using several methods of drug delivery, such as IV, pills, injection, and skin ointments. All of these treatments are varying depending on the type of cancer and the severity. Doctors often use a combination of treatments to combat cancer. If cancer is identified at a more progressive state when a tumor has already developed, then the patient undergoes a surgery first to remove this tumor, and then they use chemotherapy drugs to kill the remaining cancer cells. When using chemotherapy drugs on cancer patients, doctors make sure to follow cycles that determine the frequency of the drug deliveries. This again varies from patient to patient, depending on how well some patients are able to handle the chemo. However, the process of using chemotherapy is often highly detrimental to patients, especially those with stage 3 or 4 cancer.
Many of you may be asking, what is nanotech and how is it being used in medicine? Next slide. Nanotechnology is the application of a scientific engineering on the nanoscale. It deals with dimensions of less than 100 nanometers. This science focuses on the manipulation of individual atoms and molecules. Now, there are many different applications of nanotechnologies. These include drug delivery, which has nanoparticles engineered to encapsulate drugs and deliver; imaging, which has nanoparticles functionalized with imaging agents for MRI and CT scans; diagnostics, which has nano devices that are being exploited to detect biomarkers, pathogens, and etc. Therapeutics, which has stimuli-responsive nanoparticles designed to release drugs in a response to triggers. And regenerative medicine, which has nanoparticles with growth factors that can promote tissue regeneration and repair tissues. Next slide. Now, drug delivery systems are technologies that can carry drugs throughout the body. With drawbacks to conventional drug delivery systems, nanocarriers have gained immense interest among medical professionals. These nanocarriers are used as carrier systems for targeted delivery at specific areas of the body. These nanomedicines improve drug bioavailability, which is the measure of how much a substance is able to access the circulation and reach the target area, and it depends on absorption and secretion. These nanocarriers also improve on drug absorption and reduce release time. Next slide. Medical imaging refers to the technological ways to view the human body, allowing for diagnosis, monitoring, and treating medical conditions. Nanoparticles can be used for imaging and allows medical professionals to evaluate gene detection, protein analysis, enzyme activity evaluation, cell tracking, early stage disease diagnosis, tumor-related research, and monitoring of real-time therapeutic effects. The use of nanoparticles in MRIs achieves greater contrast, which allows for better differentiation of pathologically altered tissues from healthy tissues. Next slide. Diagnostics are tests that are used to figure out what condition is affecting a person based on their symptoms. Nanotechnologies help with this, as they are better used to accurately determine disease state, pathology of condition, and the identification of the causative organisms. Nanobiosensors, which use indicators, are able to distinguish between cells and recognize certain cells, especially cancer cells, using biomolecules that are released or produced by such cells. This allows monitorization of that region to check for the rate of growth and development, along with checking how it responds to traditional medicine. Next slide. Regenerative medicine is the development and application of new treatments to heal tissues, organs, and to restore function that is lost due to aging, disease, damage, or defects. Nanoparticle synthesis for regenerative medicines focuses on the development of entrapment and delivery systems for genetic material, biomolecules, bone morphogenic proteins, and for reinforcing the bioactivity of 3D scaffolds for tissue engineering. Next slide. Therapeutics. Therapeutics is the treatment used to alleviate or prevent a particular disease. Due to the extremely small size of nanoparticles and other nanostructures can enter cells, interact with organelles, and yield distinct effects. And due to that, these nanostructures contribute to significantly in drug delivery systems, contrast agents, photothermal effects, and imaging. Next slide.
Okay, now we'll go over how nanotechnology is being used to help cancer patients and assist cancer treatments. Nanotechnology benefits cancer patients in many ways. By allowing for early detections, doctors can identify cancer in patients at early stages to make it easier to treat. Nanotech helps with cancer therapy by enabling more enhanced drug delivery and reducing side effects. Lastly, nanotech benefits cancer patients by providing diagnostics by using biosensors and nanodevices. Nanotechnology allows for early detection by enabling the development of nanodevices that detect specific biomarkers associated with cancer. Using nanoparticle-based imaging agents, doctors can visualize tumors through various imaging modalities. Nanoparticle-based detection methods allow for the analysis of rare cancer cells or cancer-related biomolecules circulating in the bloodstream. Along with the ability to detect cancer at earlier stages in patients, nanotechnology can help to continue monitoring a patient's health, using the same nanodevices that detect biomarkers, performing liquid biopsies, and imaging with the help of nanoparticles. However, there are also nanomaterial-based wearable sensors for continuous monitoring of physiological parameters in cancer patients. Nanomaterial-based sensors integrated into wearable devices can monitor vital signs, biomarkers, and drug levels in real time, providing valuable feedback on patient health and treatment efficiency. Lastly, nanotechnology enhances cancer therapy by allowing for a more targeted and controlled drug delivery system. Nanoparticles can be engineered to encapsulate chemotherapy drugs, proteins, nucleic acids, or other therapeutic agents, protecting them from degradation and enhancing their delivery to tumor cells. This targeted drug delivery approach improves the efficiency of chemotherapy by increasing drug concentrations at the tumor site and reducing systemic toxicity. Nanoparticles enable controlled release of therapeutic agents by providing sustained drug release over time. Drug-loaded nanoparticles can be designed to release their cargo in response to specific stimuli, such as changes in pH, temperature, or enzymatic activity within the tumor microenvironment. Nanoparticles can be functionalized to promote immune activation and anti-tumor immune responses. Immunomodularity nanoparticles can also modulate the tumor microenvironment to enhance immune cell infiltration into tumors.
The statistics and the future of nanotechnology. Next slide. Okay. With the help of nanotechnology, there is a higher 5-year survival rate. These cancers are detected at an earlier stage with the help of nanotechnology, resulting in a higher significant 5-year survival rate. Next slide. As time goes by, nanotechnology has been proven to be revolutionary. Nanotech can help in the future and help improve precision medicine, nanomedicine, nanoelectronics, and nanobiology. Oh, nanobiotechnology. Next slide. And these are our sources that we use for our research. And the last slide is the contact information. Thank you.
Yeah, thank you for putting together this presentation, teaching us all about cancer and nanotechnology and how the two are kind of related and how we can use nanotechnology to further advance cancer treatment. I think this is a very active area of research, and many people are looking to collaborate with different fields to kind of look for new approaches for treating cancer. Yeah, thank you, James and Sana, for making this presentation. I wanted to thank all of our interns. We had a really diverse cohort of interns this semester who had very diverse interests related to medicine. And I really enjoyed listening to all of your presentations. And I'm really grateful that you guys were able to kind of share with us the areas of medicine that you're interested in. And I definitely think that we gain a lot of insight into the different areas of medicine that you all showed us this semester. And thank you for everyone who joined us throughout these presentations. And we hope these are very informative and kind of helpful in shaping your future directions in medicine. So as of right now, we're planning to organize for future semesters. So the next semester we're planning for is probably summer, and we'll definitely send out more details in the coming weeks. And then we're also looking to recruit a leadership board, so we'll send out applications for that in the coming weeks as well. And if anyone has any feedback about how we could kind of improve the internship, please feel free to reach out to us. If you have any questions related to what classes to take, what to do over the summer, or any life advice in general, you can always feel free to reach out. But yeah, I really wanted to thank everyone for joining us this semester. And I know we all have finals, different exams around the corner, so I want to wish you the best of luck with that as well. And yeah, if nobody has any questions, you guys are free to go, and thank you for a wonderful semester.